Praveen sir, namaste.
ನಮಸ್ತೆ ಸರ್.
ಊಟ ಆಯ್ತಾ ಸರ್?
ಊಟ ಆಯ್ತು ಸರ್, ನಿಮ್ದು?
ಆಯ್ತು ಸರ್. ಸರ್ ಒಂದು 2:05 ಸ್ಟಾರ್ಟ್ ಮಾಡೋಣ.
ಎಸ್ ಸರ್, ಶೂರ್ ಶೂರ್ ಶೂರ್. ಈಗ ನಾನು ಇದು ಪಿಪಿಟಿ ಶೇರ್ ಮಾಡಲು ಅಥವಾ ಆಮೇಲೆ ಶೇರ್ ಮಾಡಲು?
ನೀವೇ ಶೇರ್ ಮಾಡಿ ಸರ್.
ಈಗಲೇ ಮಾಡಲಾ?
ಮಾಡಿ.
ರೈಟ್ ರೈಟ್. ವಿಸಿಬಲ್ ಸರ್?
ಎಸ್ ಸರ್, ವಿಸಿಬಲ್.
ಆಡಿಯೋದಲ್ಲಿ ಏನು ಸಮಸ್ಯೆ ಇಲ್ಲ ಸರ್? ಆಡಿಯೋ
ಕ್ಲಿಯರ್ ಇದೆ,
ಎಸ್,
ತೊಂದರೆ ಇಲ್ಲ.
ರೈಟ್ ಸರ್.
ಆಯ್ತು ಸರ್.
he has organized and he has demonstrated many Panchakarma. It's really, I'm really with the medical college when they are celebrating 50th year of their institution. And I know that Pandit Taranath, as well as the Institute of Taranath Ayurveda Medical College, also has contributed a lot to the Ayurveda system. And I know many of the the academician, clinicians, researchers. They have got a background of Taranath Ayurveda Medical College, so it has done a wonderful job in the field of Ayurveda. Today, when we are speaking about Panchakarma, the name comes to our mind is Professor Dr. Ishwar Reddy sir. And humble pranams to his soul that he has given so much of contribution to the system of Ayurveda as well as the Panchakarma, so that we could practice Ayurveda in a better, much better manner. Owing to the problems which the ancient people have faced because of the masking of Ayurveda, non-support of Ayurveda, and the more support to the contemporary system of medicine. And recently that the government is also supporting the Ayurveda and Ayush system, that the Ayurveda practice and Panchakarma system has come into the mainstream. The topic which has been given to me for today's oration is principle and practice of the Nasya Karma. When we speak about the Panchakarma practice, there are a few practices which are very frequent and which are more popular, and many people practice, and one of them is Nasya Karma. Undoubtedly, this is one of the very important procedure of Panchakarma. Having said that, one more question is being raised, is that is the Nasya Karma is practiced as it is written in the context of the classical version? Is it really been practiced in the way, the methodology which is being explained in the classical version? Are we really following the same methodology, or is there any improvisation or improvement in the practice is essential? Or many times what I have observed is that the Nasya Karma is not being practiced as far as the classical version is concerned, or what is being explained in the classical texts. So it is very imperative and it is very important to have some idea about the Nasya Karma, what exactly is being explained in the classical version, and what contemporary science thinks about this one. When we look into the evolution of various therapeutics, the route of administration of the medicines, Ayurveda has said that this Nasya Karma is one of the very important methodology or the procedure which gives so much of improvement and so much of clinical outcome when it comes to the clinical practice. Of late, recently, almost around 20-30 years, the contemporary science also has explored so much things related to that of nasal route of administration of drug. That shows that the Ayurveda has contributed a lot in this regard, and it has explored the possibility of administration of a nasal route of administration of drug. And hence, the credit must go to the Ayurveda science, that the Nasya Karma is being considered as one of the prime modality of treatment. We are considering the mode of action. Most of the times we do say this shloka that Urdhva Jatru Vikareshu Visheshan Nasya Mishyate Nasahi Shiraso Dwaram Tena Tadvyapya Hantitan. Also, we also know that Sringatakam Prapya Vyapya Cha Murdanam, so on. So Unjadi Shikani Va Asaktam Urdhva Jatugatana Vaikarikam Ishat Shesham Ashu Dosha Samhatim Uttamangam Apakrashyati. So this is what we have understood. And most of the times we understand that this is what is the mode of action of Nasya. And we say that the Nasahi Shiroso Dwaram, that itself is considered as only the way how the nasal route of administration of drug is acting. And the clinical presentation imperative is that traditional concepts must be translated into contemporary and verifiable neurobiology and pharmacokinetics and pharmacodynamics also. Then only this will be considered as one of the important, the protocol of treatment or treatment modality, which will give clinical improvement. When we look into the contemporary pace at which the normal, the clinical pharmacology is going, then we understand that we are lagging behind a lot, and we rely only on the contemporary explanations, contemporary the formulations, and the contemporary methodology of the treatment. However, the improvement which is being yielded with the contemporary method itself is very great. That is the reason why you should understand that the Nasya Karma is in its purest form when it is practiced, then also it is going to give a very good outcome. When we look into this, what are the different, the physiological aspects related to that of the nasal respiratory epithelium, then we understand that the importance of this nasal route, where it is being highlighted that the surface area and coverage is around 80 to 90% of total nasal mucosa, and surface area is around 150 centimeters square. And the cellular composition, when we look into this, and pseudo-stratified ciliated columnar epithelium consists of ciliated cells, goblet cells, and non-ciliated cells with microvilli and basal cells. And also key important physiological features that is being explored in the context of Nasya are high vascularization, because of which, this high vascularization is there in the nasal mucosa, because of which the absorption chance is more. And dense subepithelial capillary network provides continuous blood flow and sustaining dynamic absorption gradients. And also there is one more obstacles, you may say it as an obstacle, but also there is this also need to be considered, is that the tight junctions. So these tight junctions are formed the dynamic intracellular apical complexes restricting the paracellular movement of large and the charged molecules. This may be considered as an obstacle. At the same time, this may be considered as a protective mechanism of this the nasal respiratory, the anatomy. And that is the reason why this nasal route of administration has gained more popularity in the recent times. Previously, people used to think that it is waste of the time and the resources to invest on this nasal route of administration. However, in the recent time, there are so many experiments are going on, which is stating that the nasal route of administration can be easily administered. At the same time, this can be one of the very important way of methodology in which the clinical outcome will be very good. And when we think about the mechanism of drug absorption across nasal epithelium, this is also very important prior planning for the treatment, because unless and until we know that what exactly the drug does to the body and what it does to the drug, till that time it is quite difficult to understand that why so many varieties of Nasya are being explained, and what is the mode of action of this Nasya in different forms, different based on the benefits. Also, the Nasya is being classified into various varieties, and why this variation, why the dosage is being different, and why the methodology is different, and how exactly they are going to impact on this the body and the physiological system, as well as in the pathological status. How exactly are they going to impact on the system? It's also very important aspect. And that's the reason why we need to understand about this mechanism of drug absorption across the nasal epithelium. And when primarily, if you are thinking the absorption pathways are transcellular transport, so it is especially for the lipophilic drugs. This route is very important, where passive diffusion across epithelial cell membranes are expected, and exhibits a fast rate and nearly 100% systemic bioavailability. That is the reason why most of the times you see lipophilic drugs are used in Ayurveda in the form of Pratimarshanasya as well as Marshanasya. So these specifically lipophilic drugs are explained in the context of the Nasya karma. And this, in this methodology, you can just in this form of the pharmacological form, we can understand that the drug can get absorbed 100%. Whereas one more variety is that paracellular transport, that is hydrophilic drugs, specifically the hydrophilic drugs, which is also in practice of Ayurveda, where passive diffusion between the cells via tight junctions. Right now, we have discussed about this tight junctions. This may be a protection. At the same time, this also will be an opportunity. But here, the passive diffusion is possible, restricted to small molecules less than 300 to 1000 VA due to the tight junction pore size limits. So there is a limitation as far as this mode of absorption is concerned. One more variety is transcellular endocytosis active transport, utilized by the macromolecules, peptides, or protein drugs or carrier-mediated substrates. And there are a few key advantages of nasal route. What exactly are the key important things that we need to consider the nasal route of administration is that it avoids the hepatic first pass metabolism, which is a very important thing as far as the normal pharmacology is concerned. When it is the drug is administered orally, then it has to pass through the first pass metabolism. But here in this nasal route of administration, this passes, bypass the first pass metabolism, which is an advantage. Where in the first pass metabolism, the systemic circulation, it will not go directly, but it will have a liver degradation and all those things. Early intestinal or liver degradation is being bypassed. One more thing is that the rapid onset of action. Now, if we think that from the point of view of Ayurveda, how many of the clinicians think that the Nasya can act instantaneously? Most of the times we do have some sort of limitations, but some of the Nasya which is being explained in Ayurveda are also for emergency management. But as far as the contemporary science is concerned, it has been considered that the form of pharmacology in which the drug is administered that has got the very fast action, rapid action, high vascular density facilitates a rapid systemic uptake comparable to the IV injections. So that shows that the drug which has been administered, IV and nasal route of administration, they are most to the systemic circulation very rapidly. So this is very important thing. Another thing is that the structural anatomic we are looking at into this one. Then the olfactory neuroepithelium. There are a few points that we need to consider. Then only we will understand that what are the possibilities. Because in the first slide itself, I said that Nasa Hishiraso Dwaram Tena Tadvyapya Hantitam. So we understand that it will reach to the brain. There are so many researches which has been conducted, and they have concluded that it is possible. But how exactly they are passing through this one, and what are the different modes by which these drugs are reaching to the brain, and that we need to understand. So this first thing is that the olfactory neuroepithelium. So this is a very important factor located in the superior nasal wall, and bipolar olfactory sensory neurons penetrates the cribriform plate of the ethmoid bone, establishing a direct anatomical connection to the olfactory bulb and completely bypassing the blood-brain barrier. So this is a very important thing that generally we consider that Nasa Hishiraso Dwaram is that the drug should pass through the blood-brain barrier, and thus it reaches to the brain, and ultimately it acts on the brain. But it is not the only way by which the drug is being absorbed. Recently, the important studies have shown that the trigeminal nerve is also very important. It plays a very important role in the absorption. The trigeminal respiratory pathway, how exactly it is involved. It innervates both the respiratory and olfactory mucosa, and afferent fibers project through the ophthalmic, maxillary, and mandibular divisions, entering the blood-brain stem at the pons and terminating in the spinal trigeminal nucleus. So this is also very important thing. Third thing is that the trigemino-cervical nucleus convergence. So this is also a very important thing. Most of the times we do say that the Nasya has got a wonderful action in cervical pathologies, cervical spine pathologies, and we couldn't find an understanding or maybe some references stating that how exactly it is going to act on this one. This is one of the very interesting things which is there in the modern pharmacology, as well as there are so many studies are conducted. Trigeminal afferents converge directly into the upper three cervical spinal nerve. So C1 to C3 within the pars caudalis of the TCN. And this bidirectional neuroanatomical network explains why localized orofacial and diurnal nociception refers to the cervical spine and vice versa. So this is how the contemporary science has understood that the different ways at which the drug, when it is administered, or if it is, how the connections are there, how exactly they are interconnected, and we understand that the interconnections are very much there. The submucosal lymphatic network, this is also another area where it is, being most of the times it is being neglected, but this is very important. The submucosal lymphatic network, the highly vascularized lamina propria coupled with the extensive lymphatic drainage directly into the cervical lymph nodes, and small molecules therapeutic cross this barrier to achieve the direct nodal targeting and minimizing the systemic exposure. So this is a recent advancement. We'll go through these studies, but recent advancement of the nasal route of administration. It has been considered that directly, if some drug has to be targeting on the cervical lymph nodes, then nasal route of administration is the best way by which the drug can be, the lymph nodes can be targeted. So this is a very important thing. However, now pharmacokinetics, what are the pharmacokinetics by which the drug passes? This is also very, very important one to know. Intraneuronal, that is axonal transport. This is one of the very important transport. Active endocytosis by the olfactory or nerve the terminals, and bioactive compounds travel intracellularly via slow axonal transport, that is velocity approximately 2.5 mm per hour, straight into the neural cytoplasm. So this is a very direct transport, intraneuronal transport. And one more thing is that extraneuronal bulk flow is a perineural bulk flow, where the rapid paracellular diffusion through tight junctions into the perineural surface surrounding vesicles, and driven by the convective bulk flow within perineural lymphatic channels, compound reach to the subarachnoid space and cerebrospinal fluid within minutes. So this is also another route which is being found out, that the drug can even reach to the cerebrospinal fluid. Systemic versus the direct lymphatic clearances. While a fraction enters the systemic capillaries via passive diffusion, lipid-soluble agents utilizes the submucosal lymph pool high target tissues accumulation. This is also another thing. Pharmacodynamics of the Nasya also need to be understood, and among that the intranasal, the receptor modulation, and the molecular environment, the role of transient receptor potential channel. This is also very important. Intranasal trigeminal sensations are mediated by localized TRP ion channels embedded within the respiratory mucosa, and TRPV1 activation, the nociception alert system, which is there in the body, targeted by irritants and lipophilic agents. This is also very important one. The application of these all things we will see in the later part of the presentation, that especially this TRPV1 activation is targeted by irritant and lipophilic agents, and TRPV1 targets robust cellular depolarization and firing rapid neuroprotective and survival pathways is also been proved. TRPA1 and the environmental sensing acts as a broad chemical sensor for pungent volatile compounds and aldehydes like acrolein and the others. It operates in close functional coupling with the TRPV1 to get the neurogenic inflammation, TRP8 and TRPV3 modulation, TRPM activated by the menthol, and isopulegol and regulates physiological cold sensing and subject to nasal patency, while TRPV3 gated by the carvacrol and senses thermal warmth, and the bradykinin gated PFC pathway, which is found that the pro-inflammatory tissue damage releases endogenous bradykinin, which binds with the phospholipase C coupled with the BK2 receptors. This cascades mobilizes the intracellular calcium stores, sensitizing the TRPV1 and opening the TRPA1 channel to cause acute nociception excitation. So these are the various methodology by which the drug reaches to the brain. At the same time, what body does to the drug, all those things, the pharmacokinetics as well as dynamics, we need to understand. Then only we can understand our own system of medicine, where the Nasya is being considered as one of the prime modality of treatment in treating various systemic conditions as well. When the advanced lipid medium matrix says that the structural rationale of the Snehana and the Thaila Nasya. How exactly this Thaila Nasya? Because most of the times when we see, many of the practitioner practices only Thaila related, the Nasya or Nasya, which is being done with either with Thaila or Grita or Avartis or any other forms, related forms. So this is why exactly only this lipid is being more considered in the Nasya karma. So in the definition of the Nasya also, Aushadha Siddha Sneho Va, he says that Aushadha Siddha Sneho Va Nasikabhyam Diyate iti Nasya. So Aushadha Siddha Sneho Va Sushruta is clever in explaining Aushadha and Aushadha Siddha Sneha. These two are being broadly classified. Aushadha refers to other forms of drug, and Aushadha Siddha Snehova refers to the lipophilic drugs. So these two drugs exactly they are being highlighted, and that show that there must be a bifurcation between the selection as well as the understanding as well as the clinical application of these two forms of pharmacological forms of drug. That's why it is imperative to know why exactly this is being highlighted here. Bypassing the epithelial barrier, when the Sneha Dravya is being used, lipophilic preparations such as medicated Thaila and Grita processed with the Mrudupaka. Sometimes it is a Mrudupaka, sometimes it is also considered as a Madhyama Paka. So generally it is the Mrudupaka which is being highlighted, possesses an ideal oil in water or missile partition coefficient. So this Mrudupaka is being considered as one of the oil in water, the missile partition. So this is very important. Now, the formulation which is having the water content as well as the oil content, one is immersed in another one. So that shows that generally we know that the preparation of basti is being highlighted as the emulsion. So emulsification which is being done in the form of a preparation of basti. Similarly, in case of Nasya also, some sort of modification they have identified and some sort of specifications they have given, so that the outcome of this Nasya would be much better. The blood-brain barrier imperative. So this is an endothelial tight junctions of the blood-brain barrier restricts nearly 98% of the hydrophilic small molecules, lipid-soluble mediums, allow passive transcellular diffusion across the nasal epithelium and the blood-brain barrier interface, and facilitating the plant-mediated green nanoparticles. Is that natural phytoconstituency is like polyphenols and flavonoids and triterpenoids, saponins, in case of bacosides, behave as organic reducing and capping agents when encapsulated in the lipid or smart nano emulsion carriers. So this is a latest studies are going on in this the nano emulsion. So emulsion, we know emulsion, emulsification, and the nano emulsion. This kind of the studies are also being taken up by the pharmacological the fraternity, and they are working on all these different varieties, and this is found to be very beneficial because the phytoconstituencies also can be incorporated in that the lipid encapsulated form, and ultimately it becomes a smaller size in the smaller in the size, and ultimately that can into the that can be penetrated into the system very well. So one more important thing is that the intranasal neuropsychiatry. Sometimes we know that the drug acts on different system of medicine, and ultimately we understand that the Nasya acts only on brain, and we understand that it acts mostly on the central nervous system. And we forget many times that the local action, systemic action, and multi-system action is also being forgotten, but definitely that has to be considered. So here, actually, there are this effort is being done to identify what are the different level at which the Nasya actually acts and how exactly it is going to act. First and foremost is the intranasal neuropsychiatry and serotonin and melatonin gating. So this is also very important. The targeting the epithalamic axis for
people are covering it. Next month, every month data.
First is the nose to brain delivery and central neurochemical modulation. In this, actually, you need to understand that the neuropsychiatric challenges, many certainly acting on the therapeutic phase limitations due to the blood-brain barrier, including the restricting permeability and active efflux, the mechanisms such as P-glycoprotein transport and nose-to-brain pathway. The intranasal delivery provides the potential route for enhancement of central nervous system exposure through the olfactory and trigeminal pathways. Limbic network interactions like bioactive compounds derived intranasally may influence the brain regions involved in emotion and cognition, including the limbic system and amygdala and hypothalamic circuit. So this is very important. One second thing is that modulating the serotogenic 5-HT signaling in the neuroactive phytochemical effects. The bioactive compounds from the Medhya Rasayana plants like Brahmi and Shatavari to a certain extent have been investigated for potential effect of serotogenic pathways and neuroplasticity and stress response mechanism. And
sorry for the interruption, sir.
That modulation of 5-HT receptor pathway, including the 5-HT2A and 5-HT3 system, may contribute to change in anxiety and stress perception and mood regulation and pain the processing. Melatonin regulation and sleep-wake cycle modulation, pineal circadian axis. In that, the intranasal neuroactive compounds.
Sorry for the interruption, sir.
Hypothalamic and circadian regulatory network, including the suprachiasmatic and the melatonin-associated pathway and potential clinical application. And in the research perspective, Nasya therapy represents the potential integrative approach of neuromodulation. However, controlled clinical studies are required. So this actually looking into this, not only the brain as a structure, but also functionally, there are so many disorders in which the drug, the Nasya therapy is being highlighted, and that has to be identified and that has to be implemented. So in this total set of the mode of action, we could understand that the Nasya, when it is administered through the nasal route, that can act on the sleep, that can act on the mood, that can act on even the neurophysiology as well. In the different pathological conditions also, it acts very well. Now, when we see, there are few of the researches which are published in the PubMed indexed journal. This is one, the comparative impact of yoga and Ayurveda practice in insomnia randomized controlled trial, which has been published in 2023 by Verma K et al. And here, actually, this study says that Nasya Karma in a central neuropsychiatric disorder, how exactly it is going to act. So the study says that compared to impact of yoga and Ayurveda practice. In the yoga Ayurveda practice, it is actually the Nasya which has been given. In this Nasya, actually specifically, it is not the Marsha Nasya which has been given. It is the Pratimarsha Nasya which has been given in the dosage of 2 drops. Remember this. The 2 drops which has been given, it is not as per the classical version. Classical version says that the dosage of Pratimarsha Nasya should be 2 bindu. But in this particular study, the study is being conducted in presence of some of the Ayurveda practitioner, and this has been the dosage is been finalized as 2 drops, and this participants were 120 and 112 completed the study, and specifically the improvements in the sleep quality is very good, and perceived stress, cognitive failure questionnaire, and quality of life and overall conclusion. Also, it is found that Nasya is definitely, it has got action. But having said that, in this study, they have concluded that yoga is better than Nasya, and it is better than the control group also. In all the groups, the outcome was seen that showed that there is something which is maybe taken positively, something may be taken as negatively from this study as well. One more important study which has been published in one more journal, that the effectiveness of Ayurvedic oil-based nasal instillation medicines in the treatment of facial paralysis, a systemic review. In this systemic review also, you could find out that the Nasya which has been the studies are taken, and then it is a systemic review is being done. That also it is found to be very, very beneficial in the management of facial paralysis. Specifically, it is not being specified whether it is a condition of Bell's palsy or it is a case of the upper motor neuron facial paralysis. But definitely in this, the systemic review they have taken, which wherever it is a facial paralysis and Ardita, it is being explained, and the Nasya is being considered as one of the mode of, the drug of, the methodology which is being utilized. So those all things are being considered together, and ultimately they have found out that this is found to be very beneficial in the management of Ardita management. One more important article which has been published by Shamitesh Tripathi et al. On the efficacy of Shatavari Tail Nasya and Brahmi Grita in the management of Apasmara in J. Pharma's Scientific Innovation in 2016. In that, the single group study, it was a single group study with the 34 registered patients with Apasmara treated with 7 days course of Shatavari Tail Nasya, followed by Brahmi Grita for 2 months, and the clinical reversals like the rapid reduction in the frequency, duration, and severity of grand mal episodes, which is less than 0.001 statistically, which is very highly significant. Especially here, the important thing that we need to consider is that the study has taken grand mal epilepsy cases, and in that also they could find out that this is found to be very beneficial. However, one more important thing that need to be considered is that in this total study, the treatment is being done with the Shatavari Taila for 7 days and followed by Brahmi Grita Nasya. So still, it is quite difficult to conclude the total study that did the Nasya give benefits or the Brahmi Grita give benefits. However, this can be considered as the combination of treatment has given a very good improvement in the management of the Apasmara. One more important study which has been published in on Bernstein et al. Has published this the study entitled randomized double-blind parallel trial comparing capsaicin nasal spray with the placebo in subjects with a significant the component of a non-allergic rhinitis. So you see, this is a very important study. No doubt, this is not related to that of Ayurveda. We may omit this study. Sometimes we may say that this is not aligning with the principles of Ayurveda, but also you see this capsaicin externally also this has been used in the form of the nasal administration. Also this has been used, and this study was a randomized double-blind parallel placebo-controlled trial evaluating the intranasal capsaicin spray over 2 weeks. And here, important thing is that the idea of the treatment is a desensitization. So it says actually in the study says that sympathetic resolution achieved rapid and significant relief of severe non-allergic arthritis and mixed rhinitis symptoms, with a mean time of first symptom relief with 52.6 seconds. Just imagine, within a minute, the person is getting very good, improvement, and molecular action is being found to be, it is a capsaicin desensitizes hyper-responsive nasal sensory C fibers and correcting the autonomic imbalance and parasympathetic hyperactivity without causing rebound condition or mucosal injury. One more thing is that the trigeminal stimulation of the midbrain and reticular cortex. It's also very important, interesting one, that there are so many pathways which is being found out through the pharmacology, and the kinetics and dynamics are still advancing, and still the work is going on. But as far as the today's day is concerned, whatever the research outcomes are there, we need to know, and we have to adapt all those things which are being found as true to our own system. Then only we can just grow. As there is a chance of improvement. There is always a chance of improvement in the methodology, improvement in the pharmacology as well. This trigeminal stimulation, since neuroactivation cascades in the arousal of modulation and coma recovery. So generally, we say that the Ayurveda has got a potential in treating coma patients. There are so many coma patients. They maybe recovered with the Ayurveda mode of administration. In that, Samjna Sthapana Nasya. So it is Samjna Sthapana Nasya which is also being highlighted. Samjna Sthapana itself, the name itself says that it is actually given in conditions where the person is in coma or a stupor condition. But here we need to understand that how exactly this is going to act. Trigeminal reticular activating system pathway. This is a very important trigeminal reticular activating system. Afferent trigeminal activation is strong sensory stimulation of the nasal mucosa, like Tikshna Pradhana Nasya or Avapeda Nasya, when we are administering through the nostril, activates the trigeminal sensory afferents involving the ophthalmic and maxillary divisions. Trigeminal afferent signals relay through the spinal trigeminal nucleus and project to the brainstem arousal network, and including the reticular formation and thalamocortical circuits. And enhanced trigeminal input may increase the activity within ascending the arousal pathways, promoting the cortical activation and sensory processing and wakefulness through the widespread neuromodulator projections. One more important thing is that the neurobiology of receptor-mediated sensory activations. Here, TRPV1, we have discussed about this, TRPA1 sensory axis. Irritant or pungent compounds activate the chemosensory receptors such as TRPV1 and TRPA1 on the trigeminal nerve endings, generating robust afferent signaling. And activation of these receptors initiates the intracellular pathways involving calcium influx and phospholipase C signaling, and contributing to the sensory nerve excitation and autonomic response. And the neural network response is that increased sensory input may influence the brainstem arousal circuit and modulate autonomic and cortical activities. Also, very important thing that we need to understand that this is how it is going to happen. Previously, we have seen that the capsaicin is being used as a nasal spray, and this capsaicin is also, it is irritant and it is desensitization. To a certain extent, this is fine. Even we are having very Tikshna Dravya in our Ayurveda practice, like administration of Trikatu and administration of other varieties of Tikshna Dravyas. Even the aroma drugs are also used, like Vacha is also considered as a Samya Prabodhana. And these all drugs acts through this pathway only. And trigeminal stimulation also, you see, the contemporary research on trigeminal nerve stimulation suggests that the potential effect of cerebral perfusion, metabolic activity, and functional connectivity within the arousal-related brain network. And clinical translation of this one can be considered like this neurophysiological mechanism provides a possible rationale of exploring the traditional stimulation-based approaches described in the conditions such as sannyasa, murcha, and smriti bhramsha, and all those conditions. Definitely, we can just understand the mechanism through these pathways. There is one more article which has been published in the Ancient Science of Life in 2016 by Ramte R.S. et al., which states that the efficacy, it shows that the efficacy of Nasya in hypoxic coma. So it says this, the case study, it is a single case study where the author has explained that 61-year-old female in a hypoxic coma followed by acute mid-cerebral artery infarct with a baseline Glasgow coma scale of 3 out of 15, which is unresponsiveness and tracheostomy and on rails tube in situ. So this is a very challenging case. Actually, whenever the person is on rails tube, one nostril is already blocked and another nostril, only one nostril is still patent. So the administration of Nasya, they tried in this total condition where from day 1 to day 7, the Pradhama Nasya is being given with the Trikatu Churna. As I said, the drug which is having more potency, more Ushna and Tikshna, and it is actually irritant drugs which also can act over such conditions. So this drug is being selected in this, and from 8th day to 14th day, Dhuma Nasya is being considered like a morning inhalation of smoke from the samnyas stapana dravyas like Vacha, Hingu, Gupulu, and TGAMC and Amalaki. And clinical improvement, you see, then on day 3, first clinical response, spontaneous eye opening was seen. So this is a very instantaneous, I don't say that very drastic improvement, but still 3 days continuously the Pradhama Nasya is being done, and on 3rd day, because of consistent and persistent the administration of this Pradhama Nasya, probably the system is being stimulated, and ultimately the person started responding to this kind of treatment. On day 14, GCS improved from 3 out of 15 to 11 out of 15. The spontaneous eye opening and basic command response and movement were seen. Proposed mechanism, what is being explained in the article, is that nasal delivery bypasses the blood-brain barrier via the cribriform plate to stimulate the olfactory tract, thalamus, and reticular activating system to provoke arousal. So this is a proposed mechanism. But however, my opinion on this one is that this is not really, the drug has not gone beyond the blood-brain barrier, because the drug is actually the physical drug, which is irritant drug, which is in the powder form. This is actually not the lipophilic drug. And when the drug is not lipophilic, then the penetration of blood-brain barrier cannot be expected either from the point of view of the Pradhama Nasya, or otherwise even the Dhuma Nasya can irritate, but it cannot pass through the blood-brain barrier. But still, this reticular activating system, already I have discussed this point, that reticular activating system is activated, and because of which the person has got complete benefit out of this treatment. Now that one more method of the Nasya is Dhuma Nasya. There are few confusions. Some sort of people say that Dhumapana is different from that of Dhuma Nasya, and only the route changes. Of course, Dhumapana is done through the nostril, the mouth, and it is expelled out through the mouth, whereas Dhuma Nasya is inhaled through the nostril and exhaled through the mouth. So this is the only difference. Otherwise, that is the reason why, though in the explanation of Nasya, Charaka has explained Navanam, Orpidam, Dhapnam, Dhumam. So Dhuma is also variety of Nasya which has been explained, but in the explanations, he has hardly given any explanations related to that of the Dhuma in that context of Nasya. But he has explained already in the Sutrasthana when explaining about Dhumapana. He has explained widely about, extensively about this Dhumapana, and the same Dhumapana can be, incorporated. However, this word which is being used in case of the Dhuma says Prayogika Dhuma and Snehika Dhuma and Vairechnika Dhuma. And these three are highlighted in the context of Dhuma. When you see this similar word like Prayogika is used for Shamana Nasya, Shamana Sneha Nasya in the context of Sushruta, that shows that they are trying to say that the Prayogika is similar to that of Shamana variety of Nasya. And here also in the Dhuma Nasya, it is a Shamana variety of Nasya, and how exactly this aerosol dynamic of volatile polypharmacology acts. Beyond tradition, this is actually the gaseous extension. Now this Dhuma, whenever it is administered through the mouth and through the nostril, how exactly are they going to change its action? Especially the nasal respiratory mucosa is highly vascular. At the same time, it gets irritated very well because of the gaseous nature of this drugs. This is always going to act on faster compared to that of the oral variety of this one. And moreover, we have got a therapeutic specialization. Specifically, when you see other contemporary, the other shastras, there they mentioned about Kasagna Shwasagna Vamakaduma as well as. So this is a Vamakaduma, which is also very interesting, that the drug which is being administered in the form of Dhuma. When you see this Kalpasthana also say that whenever the person is having the psychiatric disorder, there actually you have to give a Dhuma out of the nails and aroma and all those things to be taken together, and that has to be burned, and that has to be the person has to inhale this pungent and very irritant kind of Dhuma, because of which the chemoreceptor triggering zone is being stimulated and a person starts vomiting. So this is another important thing. So ultimately we need to know that there are different pathways by which this acts. In phytochemical properties of aerosol phytoconstituencies, droplet and fume dynamics also there, and volatility and partition coefficients like volatile oil also can be reached there. And molecular research rationale of the respiratory action say that Kasagna and Shwasagna mechanism inhaled volatile compounds active local mucosal receptors induce the rapid reflex mediated bronchodilation and downregulating the hyperresponsive cuff center in the brainstem. That is also quite possible whenever we are speaking about Kasagna and Shwasagna. And Vamaka gaseous gating, that is volatile emetic compound, trigger direct topographically targeted stimulation of a solitary tract nucleus and the area post-stima, the chemoreceptor trigger zone, via the olfactory and trigeminal sensory afferents, driving the mediate controlled therapeutic emesis without gastrointestinal mucosal degradation. So this is how you can also think about the various forms. So there are different varieties of the Nasya which has been explained in the Ayurveda classics. They actually act in a different pathway, and differently they give benefits to the body, and it actually gives a positive outcome in a various clinical setup. When we look into what are the barriers, so the pharmacologically, what are the barriers and the formulation strategies? How should be our formulation strategies? There are few barriers. And the barriers are mucociliary clearance. So body responds naturally, and rapid mucosal turnover removes the unabsorbed formulation within 12 to 20 minutes. So this is the only time at which the drug which has been administered through the nostril stays in contact with the nasal mucosa. And then the enzymatic barrier, that is a pseudo first class, that is the presence of proteolytic enzymes and cytochrome P450 and peptidase in the mucose degrades the peptide proteins. So this is also enzymatic barriers is also another barrier which is very much difficult to pass through these different varieties of problems. But formulation strategies to overcome barriers, that is also very important and interesting one. Recently, in the pharmacological studies, what they have identified is that different formulations definitely can help, overcoming these kind of barriers. And one of them is mucoadhesive or gels extend contact time with the nasal mucosa, like chitosan and cellulose derivatives, and permeation enhancers, reversible open tight junctions to boost paracellular uptake of hydrophilic drugs, and the nanoparticles and lipid carriers protect active drugs from enzymatic breakdown and improve mucosal penetration. These are very important and very interesting one, because you see the final one, it's a very important thing, is that the nano emulsions I was just thinking about, is that the drug which is actually administered through the nostril, that may get degraded because of the enzymatic action, and that is being protected with this one. So the modern pharmacology is going through a very rapid pace, and they are trying their level best to make this nasal route of administration more potent and more beneficial to the mankind. When you see these two are the examples where the contemporary science where they are going. This article is also published in PubMed Index Journal. Formulation optimization and in vivo characterization of thermosensitive in situ nasal gel loaded with the bacoside for treatment of epilepsy. You see here in this formulation, if you see the bacopomolary is being taken, which is our own drug, and then they have prepared optimized in situ nasal gel base. So this is a nasal gel base, which is actually they nullify all those barriers. So that is how this is being tried in the in vivo study, and this is found to be very beneficial. Second study, if you can see this deep cervical nodal targeting via intranasal route. So this study entitled Evaluation of Pharmacokinetics of Intranasal Drug Delivery for Targeting Cervical Lymph Nodes in Rats. And this study says that this is possible, and this drug which has been administered, in this case it is a pharmacokinetic modeling, is a tracking methotrexate as a highly polar hydrophilic model drug administered intranasally in distal rats. So it is a hydrophilic drugs. It is not the lipophilic, but it's hydrophilic. But they are trying to make sure that the drug acts on local, the component and of the body, and ultimately it acts only on that cervical lymph node, so that the other part of the body is not being targeted. So generally, what happens is that it is taken in any form of the pharmacological route. The drug is going to act on multi-system, and here it is it is going towards one targeted point, and it is only acting on cervical lymph node. So it's very interesting, and these kind of things are very essential. So conventionally, innovations in the intranasal engineering is continuous process, of course. But here there are comprehensively made a list that what are the different things which are going on. Smart drug delivery system as a research benchmark. Smart drug delivery system, which has been very path-breaking thing in the contemporary pharmacology. ROS, responsive linkers like modern nanocarriers employ kettle linkers that selectively break down and releases their therapeutic payload only within the oxidative and hyperinflammatory and microenvironment of ischemic and damaged neural tissues, and thermo-reversible in situ hydrogels and peptides functionized gold nanoparticles. This is also another interesting area where these gold nanoparticles are being used in the form of a nasal drug delivery system. So this is rapidly it is moving, and the contemporary pharmacology science is moving so rapid that we find it that the explanations which are explained in Ayurveda is actually it is only the traditional way, but we are not moving ahead with the contemporary advancement in the pharmacology, contemporary advancement in the science, and that's the reason why there are few shortcomings we need to identify, and then we have to nullify them by utilizing our own the current knowledge and current innovative researches which are already being conducted. What are the shortcomings? And in that, shortcomings are like methodological lack. Many times the traditional institutional trials frequently suffer with the small sample sizes, because the post-graduation and the PhD studies, sometimes small scale studies, they lack the robustness in the research, and double blinding is also not being done. Blinding itself is not being done in some of the cases, and semi-quantitative and subjective scoring metrics rather than hard biomarkers. Biomarkers we are not at all concentrating upon. We just concentrate upon only the subjective things, and subjective scorings. Generally, the science cannot stand in front of the scientific platform where only the subjective scorings are there. Biomarkers are very important. And second point is that the reproducibility crisis. Severe batch-to-batch variation exists with the raw herbal extracts and classical oils due to the geographical, seasonal, and non-standardized extraction parameters. Every company differs, every drug differs, and it's the pharmacological action differs. Many times now, even one more added to this one more point which is more relevant to today's day is that our adulterations, and adulteration in the herbal pharmaceutics is a cause of concern. At the same time, the pesticides, and sometimes because of the more plastic usage, more chemical usage, the soil is also getting spoiled, and ultimately that is the reason why many of the researchers take out those studies where it is found to be like recently there was one studies saying that the guduchi itself is a toxic. And the important thing that need to be considered is that the guduchi is not toxic, but the area in which the guduchi is being taken, that maybe the soil may be contaminated, or maybe it is adulterated, or sometimes it may be having some sort of issues related to that of the suppliers and all those things. That's the reason why there are so many issues that need to be considered here. Absence of pharmacokinetic tracking, and we do not. Contemporary pharmacology uses inductively coupled plasma mass spectrometer and advanced imaging and ligand mediated tracking to map CSF drug biodistribution over time. The Ayurveda lacks real-time PK and PD profiling to confirm the absolute brain bioavailability. And device bioengineering deficiencies, we still use the same methodology, and we still use the same methods which classical way it has been told, like use the cotton swab or nadi, or maybe with the Gokarna we use. Do not control droplet size and missed the velocity or plume geometry, or resulting in an unquantifiable drug delivery to the superior olfactory world. This is also very important, because unless and until we use a uniform way of administration, unless and until we use uniform things, so outcome still it varies from place to place, person to person, researcher to researcher. So it's a very important thing to know about all these things, because the studies which are already been undertaken, they lack in so many ways, and that cannot be presented to the scientific platform, saying that our system is far superior than any other system. So the need of our is that we need to adapt. We need to incorporate all the scientific advancement which are going on in day-to-day pharmacological science, physics, and all those changes which are there. And we need to join hands together, and we need to go ahead with the contemporary way of the advancement. So we still rely on old text, and which has been written 5,000 years back, and there is no question of moving ahead. The moment you move ahead, now you see in this Bacchopulmonary is being taken up by the modern pharmacologists, and that is being considered as the newer formulation they make, and nanoparticles they make, and nano emulsions they make, then it becomes the contemporary medication, not the Ayurveda medicine. Because this kind of dilemma is there, and the traditional way of thinkers, they think that when it is losing its own purest form, then it is considered not as Ayurveda, but it is considered as allopathy, or maybe some other system. But when it comes to the clinical practice and outcome based and advancement in the system, these all points need to be considered. Then only the practice of any sort of treatment would be more beneficial. So in this total presentation, what I have tried, till now, what I have tried is that try to convince and try to convey is that the advancement is required, and the knowledge has to be like advanced, or it need more boost from the contemporary knowledge or scientific background. Now let us move quickly into a few of the very important aspects related to that of the clinical administration or clinical application of Nasya. Till now I have not spoken about the classical versions, and now onwards also I am not going to speak upon any of the classical versions directly, because pretending that everyone knows about the classical background, and I'm just giving the gist of everything because of time constraint, because Nasya itself is a big topic, and I'll be touching upon few very important aspects which probably we may have to improve upon. And that's the reason why I'm just concentrating on a few of the things. Now onwards, we'll discuss about the clinical implication of this and the algorithm of a clinical stage-wise selection. So stage-wise selection, are we doing it? Question is that, are we doing it? And the AMA assessment and clinical class and doshic fine-tuning, everything we speak high upon the system, and we say that everything is there in the Shastra, but are we doing it? That is the basic question we need to ask, and we need to move ahead with the understanding of what is there in the Shastra and what we are not doing, what need to be done, and how exactly we need to move ahead with the classical version, at least the classical version if you are practicing, and we need to know many things which are not in practice. First and foremost thing is that the volumetric calibration and viscosity dynamics and the thermal gating. This is very important, that the volumetric standardization. The dosage pattern which is explained in Ayurveda is one bindu, where Pradeshini Anguli is being taken, and which it has to be dipped and it has to be taken out. So ultimately, many researches which are conducted on this one, and this bindu holds good only for the Taila or Grita. 0.5 ml standardization holds good for 1 bindu is equal to 1 bindu as far as the Taila or Grita, not to any other form. The water soluble drugs are there, and the water soluble drugs almost they are equal to drop wise. Like 1 bindu, maybe 1 to 2 drops. That's all. The water soluble. Like if you are taking the swarsa, it will viscous, and 2 drops, maybe 2 drops. The kashaya, if you are taking 1 drop, 1 bindu is equal to 1 drop. So the water soluble drugs which are there, they need to be considered as 1 drop is equal to 1 bindu. But whereas the Taila is there, that has to be generally. There are so many explanations and there are so many researches, and I have also done researches. Time constraint is there, so I will just speak upon this 0.4 to 0.5 ml. It is for normal adult. Are we doing it? Because in that I have said that one research which is being conducted, which on the insomnia, comparing the yoga and Nasya and control. In that, the Pratimarsha Nasya, the dosage of Pratimarsha Nasya which is being used is 2 drops. The oil which is used, and the oil need to be used, and when a Pratimarsha Nasya is used, then the dosage of Nasya should be 1 ml. And that 1 ml need to be considered as far as the Pratimarshanasya is concerned. Whereas in case of Marshanasya, it is Hrasva Matra, Madhyam Matra, Uttam Matra, 4, 6, 8, or there is a difference of opinion. So 4 bindu is 2 ml, 6 bindu, many of we are practicing this. If you are not practicing, then it is a mistake. There is one more point that has to be considered here, is that the Sushrutas dose escalation. Say that the first dose, second dose, and third dose. It is Ashtabindu as the first dose, 1 Shukti as a second dose, and 1 Panchukti as a third dose. So it is actually 8 Bindu, 16 Bindu, and 64 Bindu. 8 Bindu, and 32 Bindu, and 64. So this is actually the dosage that has to be practiced. 64 Bindu is equal to 32 ml. So 32 ml we need to administer in the form of Nasya. Then only it is going to give benefits in various conditions. What are we doing? Actually, in a practice, I have seen many people practicing 2 drops for Pratimarshanasya, 8 drops for Marshanasya. It is just like it is smearing the nasal mucosa with the oil or with the grita. It is not going to act much as you expect or as we expect in a particular clinical condition. So that's why it is very important to know about all these things. Kinetic rationality of high dose volume overload. Why it is being explained? Why? Because you see now contemporary pharmacology is more refined, and they make the pharmacological size as a very minute one, and it is going to act particularly on that particular mucosa, and ultimately chance of absorption is very high. But Ayurveda, on the contrary, the dosage is very low sometimes, and sometimes it is very high. Pratimarshanasya is lowest dosage of the lipophilic drug. The oil or grita is 2 bindu, that is 1 ml. And when you are speaking about the higher dosage, Pani Shukti is the maximum. Pani Shukti is around 32 ml of oil has to be administered. Now the question is that why so much ml of oil need to be selected? There is a confusion between the practitioner to practitioner. People say that this is, one is called as Nasapana, another one is called as Nasya. No. It is actually in the context of Nasya only, these 2 explanations are being given and need not be considered as Nasapan. We'll discuss about Nasapan later, but as far as the dosage is concerned, drug flux across the nasal epithelium is governed by Fick's first law. This is actually the first law of Fick's, say that there is a diffusion from higher volume to lower volume. The gradient, it will just move. The diffusion happens, prolonged absorption window. So there is a chance whenever high volume Nasya is administered in the context of Marshanasya, it is a Pani Shukti, increases the residence of formulation within the nasal cavity, particularly in the superior nasal wall and olfactory region, which makes sure that the drug absorbs to the maximum extent. Enhanced epithelial contact. The increased formulation volume may prolong the epithelial contact time despite ongoing mucociliary clearance, thereby sustaining drug absorption over an extended period. Because we have seen now the mucociliary clearance happens 12 to 20 minutes. Within 12 to 20 minutes, that naturally happens. But whenever you are administering more drug into the nasal route, then this may delay, and that improves the chance of absorption. Therapeutic implication, prolonged residence time may support sustained nose-to-brain drug delivery, which could be advantageous for therapies requiring prolonged central nervous system exposure, such as the neurorehabilitation and anticonvulsant therapies. Now, the temperature. When we speak about this, the dosage, yes, this is also one more point. Let me make it very clear here also, that the dosage, whenever it increases, there is one more phenomena which generally happens is that it is a Cushing's triad. And Cushing's triad, it is being explained as a small, in the small column in the Harrison Central Medicine or any neurological, textbook if you see. That Cushing's triad is being explained in a small column, because this happens, the Cushing's triad is, there are three things which comes there. One is the bradycardia, or the pulse rate will come down, or the cardiac rate comes down. Irregular respiratory rate, and then third one is that the hypertension. Transient hypertension which is seen. So these three are considered as Cushing's triad, and this happens when the intracranial pressure increases. I have seen many cases, even I have tried this 32 ml of Nasya also. In this, when it goes beyond like 10 ml dosage, generally you start getting all these features of the Cushing's triad. That shows that the intracranial pressure increases during the administration of Nasya. This is very important observation that need to be kept in mind. If a slightest mistake happens in the procedure of Nasya, person will get a terrible headache, and the person will have other symptoms like burning sensation and pricking type of pain, and all those things definitely that is seen unless and until the methodology is very correct. If the methodology is slightly, it is being missed, what Shastra says, you will get all complications. That's the reason why I asked many of the people that how many complications of Nasya did you see? People say nothing. We have not seen anything, because we are not practicing the classical dosage of Nasya. Then there is no question of the complication. Instead, there is always a chance that you may get Ayoga Lakshanas, which nobody is bothered about. So that's why it is very important right now is that we need to practice the correct dosage, and then it has to be utilized. Now, let us go into the temperature part, the Stambhana part. So it is a 15 to 20 degree. It is not like drug is being kept in a fridge and it is being utilized. It is a normal the environmental temperature. So environmental temperature, if it is around 15 to 20 or maybe 25, it is lesser than the body temperature, then naturally it has got a Stambhana effect. So Stambhana Dravya, Stambhana Nasya, which is being explained, that has to be administered in a room temperature in order to make sure that the Stambhana actually happens. Whenever you want some sort of absorption, then the temperature of the oil may be increased, like 38 to 40 or sometimes 37 to 38. So it is actually based on the Prakriti again. The Pitta Prakriti person may not tolerate higher temperature, but it will actually act on this one. The temperature increase used in Snehana and Shodhana Nasya procedures and mild warming reduces the viscosity of a lipid-based formulation, improves sprayability and the mucosal coverage, and also there is a vasodilatation, and ultimately there is a chance of absorption, more absorption. Now there is one more point to for the discussion is that the Svedana which we do in case of Nasya, generally the Svedana which has been more preferred traditionally is that the Patasveda. Patasveda, generally you take the cloth, cotton cloth, and immerse in hot water, and then the face is exposed to the steam which is being generated out of this. But there are disadvantages of this one. The Samyak Svinalakshan, because of it is given in a very closer area, there is always a chance that the person may find a pseudo Samyak Lakshana, the Svedana Pradurбhava is seen because of water vapors are directly it is going. There is one more option of this Svedana is that the Nadi Sveda. People say that you close your eyes and then you do Nadi Sveda, and the Nadi Sveda is better. Again, the same issue is that the Nadi Sveda also produces pseudo perspiration over the Lalata Pradesh. So in order to nullify that, in order to give betterment, there is one pilot study which has been conducted when I was working in Alvas Ayurvedic Medical College. So this is also been published in JREIM, and you can go through the article. And here there is actually the classical version of Nadi Sveda says that the body has to be wrapped with cloth, and then over that the Nadi Sveda has to be done. Here an attempt is being made to adapt this one by taking different varieties of the cloth. And here you can see that there is a wastage. Out of wastage, we have taken this the holder of the bulb, which is aluminum, which is lightweight, and it has been kept over the scalp. And then the cloth is been wrapped over the face so that the person should not feel suffocated. And over which the Nadi Sweta has been done. The temperature is also been taken into consideration, and other monitoring also is being done, like respiratory rate, pulse rate, and diastolic and systolic. Everything was under control. And it is very important that the study has been conducted over compared on 10 healthy persons. It is only on healthy persons, just to evaluate what will happen. And on all those things, then we have taken an average, and then we could get a conclusion. And that conclusion says that the Lalata Sweda is observed in the persons who were used with the polyester, 2 minutes 20 seconds. And the cotton, whenever cotton is used, to 2 minutes 41 seconds. Woolen is used, of course, Shastra says about woolen. But you see, this here, this study has concluded that the polyester, the cloth is used to wrap, and then is done. That is more, instantly it produces samyaksvina lakshana to 2 minutes to 20. So 2.5 minutes you will get a samyaksvina lakshana. That is very good for a Nasya therapy. If you are doing this, this is wonderful, right? Now, the selection of drug based on dosha and guna, that is very important. When you are speaking about the selection of drug, the dosha assessment and assessment of dominant guna and select opposite guna, it is a very important one, and select opposite virya, and then select which variety which you want, and brahmana, shamana, or shodhana. One more point is that based on the target tissue, like a specific drug, like if you want to take if you want to treat the brain, then Brahmi Grita you need to select, right? So that way you need to think like a Shamana Nasya. I want to take a Shamana Nasya, and the brain is a target, and Vata and Pitta is a target. Then you can use Brahmi Grita as the drug of choice. Similarly, these are the examples based on the Nidana, how the drug is being selected. Ushna Guna Vriddhi is there, then Shita Guna has to be selected. Shita Guna Vriddhi is there, Ushna Guna has to be selected. Guru Guna Vriddhi is there, Lagu Guna Nasya Dravya has to be selected. Lagu Guna Vriddhi is there, Guru Guna Nasya has to be selected. Ushna Tikshna Guna Vriddhi is there, Saumya Guna Nasya Dravya has to be selected. Saumya Guna Vriddhi is there, Ushna Tikshna Nasya Dravya has to be selected. Specifically in case of Rutu also, it is very important. Shita Guna Nasya Dravya has to be selected in Ushna Rutu, and Ushna Guna Nasya Dravya has to be selected in Shita Rutu. First of all, we speak about the Shodhana Nasya, because Shodhana comes under the Pancha Shodhana. Shodhana Nasya comes under Pancha Shodhana. So the choice of Shodhana Nasya depends on the severity of Kapha and the degree of Roksha and the Tikshna action required and the dominance of Vata. Kapha and Vata both acts oppositely. They have got the opposite characters. But here, whenever we are speaking about Shodhana Nasya generally refers to maximum time. It is refers to that of the refers to the condition where we are targeting Kapha dosha. And this is the hierarchy. You see now, if increased Vata is there, then the Shodhana Nasya is a choice of this one. And then in case the Shodhana Nasya, after the Shodhana Nasya, it is a Vairechnika, then it is the Avapedaka, and then Pradhama Nasya. When increased Kapha is there, Pradhama Nasya is the first choice, Avapedaka is the second choice, Vairechnika is the third choice, and Shodhana Taila is the third choice. Now, hierarchy of similar to the previous explanations, what I am just trying to depict here is that the hierarchy of Shodhana Nasya. Pradhamana Nasya, the predominant property is that Rokshatama. When you are speaking about Taratama property, then it is a Rokshatama. It is a drug which is being used in the form of the powder, and it is Ushna and Tikshna. And whatever drugs, if you want to take, you can take everything. Majority of the drugs, or almost all the drugs which are used, like a Trikatu in the previously explained condition, or maybe sometimes the Spratisagar Rasa, sometimes the Shwasaputa Rasa, and different drugs like Vilvadi Gulika and all those things, Rasa the Churna. There are different drugs which are there. In those cases, it's very important that those drugs are having Rokshatama and Ushna and Tikshna property, and Kafahara property is at the highest level. Preferred indications are Kevala Kapha and Bahu Kapha and deep-seated Kapha. This is a very important thing, and Avapida Nasya is Roksha Tara. No doubt it is Roksha property. If you are thinking about Roksha, then physically it is not Roksha, but it is can be considered looking at the Ushna Tikshna. Majority of the times it is Ushna Tikshna than Roksha. But the drugs which are used that may be selected, like if you want Ushna Tikshna, more Ushna Tikshna and Roksha also, then you are also supposed to take some formulations like Asavarishtas are also being indicated, that also can be selected under the Vapedaka Nasya. And preferred indications are Kaphavata and chronic sinusitis and Samnya Prabodhana. Samnya Prabodhana, of course, it is also induced, I mean, it is indicated and it is implemented in case of Pradhama Nasya also. Pradhama Nasya can be selected in Sannyasa conditions. Mada Murcha Sannyasa, in those conditions also, Pradhama Nasya and Avapedaka Nasya, they go hand in hand. And there is a slightest difference between these two. Both of them are selected in different conditions. Vairechnika Dhuma Nasya, it is Ushna Tikshna and a Sukshma Guna. Because of it is the Dhuma which is being used, it has got a Sukshma Guna, and specifically it is used because Vairechnika Dhuma that acts over the nasal respiratory mucosa as well as the lower respiratory mucosa also. So that's why it is also utilized in case of upper respiratory tract infection as well as lower respiratory tract infection. Shodhan Tailanasya, it is a Stikta Ushna and Tikshna Kaphavata disorders, it can be utilized. Specifically, Avapedaka Nasya, it has got based on the temperature, based on the quantity, it is being bifurcated into Shodhana, Stambhana as well as Shamana, and based on the drugs which is utilized there. And Vairechnika Dhuma also helps normalizing the Pranavayu and Udhana Vayu, removing the obstructing Kapha. And the major clinical implication, therapeutic rationale are Pradhama Nasya. It is used in Kevala Kapha disorders, Bahu Kapha, as well as chronic obstruction, expulsion because of highly Ruksha and Tikshna. And Avapedaka Nasya, it is utilized in case of Suryavarta, frontal maxillary chronic sinusitis, some Nasya, and breaks Guru, Sandra, and Pichula. That's the reason why of Kapha and stimulates consciousness. And Vairechnika Dhuma Pana Kasa Shwasa Nasanaha. Nasanaha refers to it is the deviated nasal septum kind of situation that can be utilized. Upper lower respiratory disorder and Ushna Tikshna Sukshma actions facilitates the Kapha Vilayana and clears the respiratory channels, and Shodhana Tailanasya Vata Kapha disorders cleanses. So the Dhuma and Pradhama Nasya, which we have already we have discussed. So aerosol particle dynamics are micro to submicro micron sized particles bypasses the upper airway clearance mechanism. So it's a very important thing is that this is similar to that of the action of this Dhuma Nasya, or for that matter to that of the Dhuma Pana. Both of them are very similar to that of nebulization. So whenever you are giving, because in the Muhurmuhu is being explained in conditions of the Pranavasroto Vikaras. So in those conditions also repeatedly, if you are administering this Dhuma Nasya has got a maximum reach as compared to that of any other variety of Nasya, because it reaches to the nasal respiratory mucosa as well as the lower respiratory mucosa also. In turn, if it is very much poisonous or if it is very much reachable and it is irritant, it is having more irritant kind of nature, then it stimulates. Like in case of Spratisagar Rasa, Tamra Basma is also there. So there actually it is more irritant. So Parada Gandhaka and Tamra Basma, all Tamra Basma is also been utilized for the purpose of Pradhama Nasya as well as Dhuma Nasya also it can be utilized. So both of them has got the similar kind of action, but Dhuma Nasya has got a wider accessibility, and it acts locally on the respiratory system first, then central nervous system. Pradhama Nasya, on the contrary, it acts on the locally on only the nostrils. At the same time, it acts on the central nervous system. So it is a very important aspect that need to be considered. One more thing is that the Marsha and Nasya, it is a local osmotic pull. The hypertonic aqueous plant extract rich in alkaloids and saponin exerts a powerful osmotic gradient. And sinus decongestion triggers rapid vasodilatation and glandular secretion and clear trap the mucopurulent sinus blockages. And focused action is rapidly clears the mucociliary movement and targeting local sinus pathology. So, important thing which need to be understood is that the local action is being more preferred over systemic action. However, this also can act whenever you are using a very Ushnatikshna Dravya that may act on the central nervous system, but not through the absorption. Absorption of this Vapida Nasya is minimal compared to that of this Marsha Nasya. Marsha Nasya, on the contrary, it has got a direct perineural transport is there, and a sustained Shamana action is also seen as far as the Marsha Nasya is concerned. Whenever you are speaking about some conditions, now let us take a condition of the sinusitis. Sinusitis is more preferred condition where the Nasya is being very frequently practiced, but most of the times we do not have an objective that what exactly is required. So objectives of this is overcoming the osteal-mechanical blockage. That is, sinus pathology, chronic sinusitis is characterized by osteal swelling and mucociliary stagnation, hypoxia, and development of pathological bacteria biofilms within the paranasal cavities, and installation of Shodhana or Kato Tikta lipid dravya or non-lipid dravya exerts the immediate mechanical and biochemical cleansing action across the middle or superior nasal mucus. So in this case, it's especially in the sinusitis, maxillary, frontal, or ethmoidal, in all the conditions, specifically, what we want is that we require Shodhana kind of Nasya. So this Shodhana Nasya has got these all actions, surfactant, dynamics and biofilm disruption, and a ciliary beat stabilization and osteal patency is also seen. Now, looking at the different varieties, now we have moved into one more action of this one is that the Shodhana kind of, Shamana kind of, and Brahmana kind of the Marsha Nasya or Navana Nasya, specifically looking at the Virya and the therapeutic action. Whatever is the requirement, based on the requirement, you need to select. Like in case of severe Vata, where the Dhatuksha is also there, then the Guna which you need to select is that Ushna Guna, Stigdha Guna, and Brahmana Guna. Example is Mahamashte. Whenever advanced degeneration is there, where more Sandra and Brahmana is required, then Samisha Mahamashtela. Mahamashtela is having Ushna Stigdha Brahmana. At the same time, the Samisha Mahamasha is having Sandra. It is ultimately it is a very good Brahmana Taila, so that can be selected. Bahu Shirshagatavata, you may consider it as a periarthritis of shoulder, you may consider it as adhesive capsulitis or supraspinatus tendonitis, whatever it may be. But in those conditions, specifically, whenever it is a degenerative conditions, then it is a Ushnatikshna and Stigdha Guna is advised, and Swalpamasha Taila, which has been classically, which has been highlighted. Here, Swalpamasha Taila has got the sign of Lavana, so that's the reason why it becomes Ushna and Tikshna. Vata Kapha disorders are there, then Ushna, Stigdha, and Shamana. If the Dvandaja conditions are there, that has to be selected. In case of the Abahuka or Mahushirshagatavata, Karpasat Taila can be selected. Ketaki Mulati Taila, specifically, which is indicated in Astigatavata, and Prasarini Taila, which is indicated in different Vata Vyadhis. It may be Prasarini Taila, Kubja Prasarini Taila, Maharaja Prasarini Taila. Different varieties of Prasarini Tailas are available. All the Prasarini Tailas can be selected in those conditions. And Shita Stigdha Shamana is required in Vata Pitta condition, and Kshirbala Taila is the ideal choice. An example is Kshirbala Taila. Pitta induced degeneration, sometimes it is a Pitta induced degeneration is there. Then Shita Stigdha and Brahmana Dravya is selected, and Shuddha Bala Taila and Kalyana Grita, specifically Grita preparations are selected. In case of different diseases like Bahu Shirshagatavata, Swalpamasha Taila, Bahu Shoshitis, Samisha Mahamasha Taila, Kampavata, Hoyner staging is there, 1 to 2 is there, then Mahamasha Taila, and Kampavata stage 3 to 4 is stage 3 to 5 there, Samisha Mahamasha Taila, degenerative cervical spondylosis is there, Bahu Stamba, Manya Stamba is there, especially in a degenerative conditions, then Parinata Kerik Shiraditela, advanced degeneration require more lubrication, then also Vidare Adigrata. Though Vidare Adigrata is indicated in Pranavasruto Vikara, this also can be incorporated in for Nasya Karma in that condition. Specifically degenerative conditions where it is a Kapha is also involved, Kapha and Vata condition. Even I have tried the Gugurtikta Grita in the form of Nasya. That also yields a very good improvement. Specifically in case of Kapha is also involved. Nidral Pata, it is a Shita Shamana Nasya is indicated, and the Nidra Nasha Mahisha Grita is indicated. Specifically in that Nidral Pata, specifically the Pitta Vriddhi Lakshanas are seen where Nidra Alpata is there. In those conditions, Shita Shamana Nasya also can be selected. In case of Nidra Nasha, Shita Sandra and Pichara Dravya is selected. Mahisha Grita is selected. There is one research which has been conducted when I was in Gandhir Saraswati College, where the melatonin secretion is being selected as one tool to see that what happens when comparing the Brahmi Grita and the Mahisha Grita Sadhita Brahmi Grita, and it is found to be Mahisha Grita seems to be more beneficial compared to that of the plain Brahmi Grita. So this shows that the Mahisha Grita has got upper hand. No doubt Mahisha Kshira is being highlighted as one of the dravya that has to be internally taken for the sleep, improving the sleep. But Mahisha Grita is selected with the intention that improving the Nidranasha completely loss of sleep kind of conditions. This is more better. Drug selection based on the doshik combinations. Vata plane, it is Ushna Stigdha and Brahmana, Mahamashtaila, and Vata Pitta, Shita Virya Shamana, it is a Shuddhabala Taila, Pitta Vata, it is a Shita Brahmana, Kalyanaka Grita, Vata Kapha, Ushna Shamana, Dhanvantara 101, Kapha Vata, it is a Ushna Shodhana, it is a Shadbindu Taila, Kapha Pitta, it is a Roksha Ushna first, then it should be considered, Shita should be considered later on, and Pitta Kapha, it is a Shita and Ushna, later Ushna Dravya has to be selected. Enhancing the higher mental faculties or maybe the functions of the mind, it is Dhi, Dhriti and Smriti in order to improve those. Jyotishmati improves Dhi and Dhriti is Brahmi Grita and Smriti it is Panchakarma Grita, owing to the Sattva and Tama properties of this and the predominance of dosha, it is a Vata Pitta and a Kapha dosha which is predominant, based on which the selection will be changed. Increasing intensity of Brahmana, it is require more snigdhata, then you need to select different varieties of drug which is having more Brahmana action. When it comes to the Pratimarshanasya, but Pratimarshanasya, most of the times it is misinterpreted, misused, and this has been utilized to substandard level. Shastra talks about 14 to 15 times of administration of this Pratimarshanasya, hardly 1 or 2 times, 3 times, maximum 4 to 5 times we say, because patients do forget and it is not in routine practice. But what is the advantage of this Pratimarshanasya is that physical barrier coating, a daily 1 ml of lipid application coats the delicate ciliated epithelium with a uniform protective film, macro pollutant entrapment. This is a very important thing. Today's day, this is a very important thing that increases the retention of coefficient of particular matters, dust and pollen. In the environment, it's a pollution, most of the polluted area, this is going to be very good. And mucosal defense prevents environmental toxins and breaking down of mucosal tight junctions. Trapped particles are safely cleaned via standard mucociliary reaction. So this enhances, actually this is a prevention which is being explained in the context of Pratimarshanasya is owing to these all varieties of mechanisms that we need to keep in our mind. So comparative overview of all different varieties of the Nasya are like Dhuma, which is a gaseous, and a smoke. Primary biological, the mechanism is a submicron biological reach and olfactory bulb stimulation. And then clinical correlation is that systemic inhalation and limbic central nervous system activation. Pradhamana Nasya, it is a dry powder, trigeminal afferent stimulation and hyperosmotic fluid pull, and it is a brainstem ARAS rosal reflex and sinus mucolysis. Here it is an important thing that I'm just trying to drag your attention is that in case of sinusitis also Pradhamana Nasya holds a very upper hand compared to that of other varieties. I was just talking about the Shodhana Nasya and the hierarchy of Shodhana Nasya. Somebody might think that, okay, why the Taila Nasya only is being highlighted there? No, Shadbindu Taila, when you compare the Trikatu Churna and Shadbindu Taila, Trikatu Churna holds a high upper hand. Whenever you are thinking about Trikatu Churna and Gudanagara Nasya is lower compared to that of the Trikatu Churna. Trikatu Churna holds the highest form. But you need to think about the guna which is more dominant, like more pichla, more sandra, more blockage, then you can plan for the Trikatu Churna and compared to that of comparatively lesser than Gudanagara Nasya. And there is one more variant of Gudanagara Nasya is that you add Kshira also. Kshira, whenever you are adding, then the total formulation become little bit lesser Tikshna, and ultimately it is going to act lesser compared to that of Gudanagara Nasya. And then compared to that of Shadbindu Taila, whenever you require more lubrication and you require some sort of absorption and some sort of action by absorbing and then the desensitizing the thing, then you require some sort of oil that has to be applied over the nostril. I hope it is clear. Marshanasya, on the contrary, it is a high dose lipid. It is a lipophilic neural sheath transport via olfactory pathway. This is the only one of the drug where the lipophilic drugs are used. Another one is Pratimarshanasya, where there is a chance of absorption. Nose to brain delivery bypassing the blood-brain barrier. Aupedakanasya, aqueous extract, local osmotic gradient and saponin and mediated evacuation. Rapid sinuses decongestion and mucosal drainage is seen, and Pratimarshanasya, microdose lipid, surface tension barrier creation and particulate capture and environmental pollutant defense and mucosal protection. And then chronopharmacology and rational dosing. This is a very important thing that the most of the times we think that daily usage of Nasya is better, or that is the only dosage or the schedule which is being explained. But we are wrong in sensing this. Shastra talks about alternate day administration of Nasya for majority of the conditions. Only few conditions there are daily absorption, daily administration. Some condition twice a day it is being explained, and there are different things that need to be considered. Twice daily dosage rational is that acute neurosensitization protocol, whereas daily dosing rational is that the structure neurorehabilitation program, and alternate day dosage rational is long-term maintenance and sustain the protocol. When you see the classical version also, as far as the Swastha is concerned, the administration of Anutaila is located or indicated on alternate days, and 7 sittings and spreading over 13 days, which has been explained in Charak Samhita in the dosage of 24 ml Ardhapala. This is what is the dosage. So recommended schedule for Navana Nasya, if you are thinking about the schedules, why it is changed, how it is different, and in which condition it has to be selected. First is Kevala Vataja disorder, daily Navana Nasya. Kevala Vataja disorder, which we more confront in our clinical practice. That's the reason why this yields very good. But the time of administration is easy. Dhatu Kshaya Vatavadi is there, central atrophy and this one, then Brahmana and Shamana Navanasya, you can plan for twice a day. When you look into the Shastra talks about Higma, Apatanaka, and the Manyastamba. These kind of conditions, Swarabheda, these conditions are there. In those conditions, twice a daily, whenever the Vata is in more Prakopa Avastha, maybe because of Vata Dhatukshaya, or maybe because of other reason, 2 times it has been explained. Kapha-Vata disorder, Shodhana, Shamana and Brahmana. There is a sequential administration of the Nasya. When we speak about Basti, we speak about Anvasana and Niruha and Anvasana Niruha, this kind of normal sequencing. But when we speak about Nasya, we never speak about this. The Shodhana Nasya or Shamana Nasya or Shodhana Nasya and Brahmana Nasya. In case of Basti, we speak about Utkleshana Basti and Shodhana Basti and Shamana Basti. In the sequential order, some interpretations are done. But in case of Nasya, it is not being taught. So it is a high time that we need to think about these kind of thing, and Vata Pitta disorders, Ushna Shita Vyathyasa protocol. In the Vityasad Upacharit, especially in case of Pitta Bhutvata condition, there is a concept of Vityasad Upacharit. This also can be selected in this condition. Other all conditions, alternate day protocol of Navananasya is indicated. So we are not supposed to change that protocol alternate days only. Why alternate days? That is also very important thing. When sequential, already I have explained about why sequentially when the Shodhana is required. In Shodhana, it is a clear macromolecular aroma and viscid mucus, and in case of Shamana, it calms active receptors and hyperactivity and pain. And then in stage 3, that is Brahmananasya, dendritic branching and neuroprotection is being done. Why this sequential administration is required is because in many conditions, Ama is there, Kapha is there, and that has to be removed, and then the Shamana has to be done, then Brahmana has to be done. Specifically, in conditions of Vata disorder, or Samavata condition, or Kapha Anubandha, in case of Vata Vyadhi, then in those all conditions, Shodhananasya followed by Shamanasya, then followed by Brahmananasya is indicated. Now, with an example, let us see this management of Ardita. Facial paralysis, specifically to that of the Bell's palsy as well as Ramsay-Hunt syndrome type 2. And in those conditions, if you enlist the signs and symptoms, this is there in the classical version also. I have added few more so that it becomes very clear that how exactly we can select. In case of Vata, facial paralysis, Tabdanetrata, and pain in the face and headache, Kampana, and Smriti Moha, and the Nidra Nasha, Karana Shula, and Roksha Jihva, Shabda Seshnuta is seen. Pitta dominant symptoms like Dahara, Gapidaka, Visarpa and Brahma is seen. Kapha dominant symptoms, Supti, Shota, and Gandha Jnana, and Gauravarasa Jnana, and Rilasa, Chardi, these all are seen. So these Chikitsa Sutra of Ardita says that Ardite Namanam Murni Pelam Shotra Kshitarpanam Sashofe Vamanam Daharagayukte Siragada. So this is a principle of treatment which is being explained. Similarly, this is the protocol of treatment or the guidelines for the treatment in case of Kapha dominant comorbidities with the diabetes mellitus or syndrome X. Panchakarma has to be done. Then Shodhananasya has to be done. Then in that, there are 3 possibilities: Pradhamanasya, Upedanasya, or Navanasya. It should be Ushnavira Dravya. And Pitta dominant condition, Roksha, Stigdha, Nityarechana has to be done, Jalauka has to be done, then Shamanasya has to be done, and it should have Shitavirya in nature. Shitavirya or Ushnavira, based on the Roto, it can be selected. In case of Kevalavata, then Stigdha Rechana has to be done, then Brahmananasya has to be selected. Or in case when the Shamana is required, Shamanasya has to be selected. In case of Brahmananasya, you got two choice, Shitavirya Brahmananasya or Ushnavirya Brahmananasya. So based on this, the treatment has to be planned. These are the 2 cases I am just showing where it is published in IJRAP journal. And in this, you can see the treatment protocol which is being done. The Nasya, initially the Nasya is being carried out with Shadbindu Taila, 4 ml in each nostril, and then it is being changed from 17 to 20 Shadbindu Taila. It is being done, and 21 to 25. Even the Nasya has been changed to Karpasas Taila, 4 ml. So this the person has yielded very good relief, and on the in the follow-up, the patient has been given with the Pratimarsh Nasya, Mahamash Taila, 1 ml. And with this, the patient has got very good relief. This is one more case where the Ardita case where the Marshanasya is initially the Marshanasya from 25, 4, 22 to 28, 4. It is a Shodhanasya. Marshanasya is being given with the Shadbindu Taila, 4 ml in each nostril, and Marshanasya later on 29 to 5. It is being continued with the Maharaja Prasarini Taila. It is going to be very beneficial, and this is how the patient's response, and patient is able to do everything. And despite of what is my observation is that the facial paralysis, when the patient approaches the Ayurveda physician in the early stage, within 15 days you can do wonders. You can give 100%. In case of Bell's palsy, when it is beyond that one, it is quite difficult to treat to make it 100% possible or 100% outcome. But in this particular case, he had come almost a couple of months later, taking all the other medication, but he didn't get any relief. But later on, it is found to be very beneficial. After doing all this treatment, he was it was very beneficial. One more point that need to be addressed is that we have discussed about Shodhana Nasya, we have discussed about Shaman Nasya, Brahmana Nasya, Alpita Nasya, Bhapana Nasya, Dhuma Nasya, everything. But there is a classical reference states that even water Nasya, Jala Nasya also can give relief in case of Manyastamba. This is there from the Bhav Prakasha. He speaks about this one. How exactly do you think that this is going to act? Plain water instilled into the nostril has a 0 salt content, whereas the body tissue cells contain about 0.9% of salt. And the chemistry says that osmosis forces the plain water to rapidly rush into the delicate nasal skin cells and try to dilute them, and the nasal cell swells up and can burst, and this triggers a sharp and burning sensation and temporarily localized inflammation. And while the initial moisture might temporarily loosen the dried mucus and ease the postnasal drip straining, the osmotic irritation often triggers a quick reflex, making tense neck and shoulders against the burning sensation. Because of the posture and mechanical strain relief, the pain is relieved. So this is also a very interesting thing, that there are few acharyas, they were not against the idea of progressing from where the previous acharyas have stopped. So Bhav Prakasha's intention was not to deviate from the concept, but also that is, the idea was to actually incorporate some more things, and simple things, simple water can relieve. And there was a study conducted in Gendra Saraswati, and instantly the pain in the neck is released when the water is being instilled into the nostril. There the Bindu Pramana is 1 drop is equal to 1 Bindu. Right. So to conclude my session, there is a blueprint is required to make our system more acceptable and more scientific. The evidence is indisputable. Panchakarma is not a simple localized therapy. It is a high sophisticated neurobiological active nose to brain drug delivery system that acts via direct neural, lymphatic, and receptor gated pathways. And the transitional task is that as Ayurveda clinicians, we must transition from the purely descriptive text reviews to rigorous biomarker driven quantitative science. And strategic imperatives are like adopt advanced polymer hydrogels and standardized nano emulsion to modernize classical lipophilic yogas, and standardized administration via modern mist delivery engineering to control particle deposition, execute large multi-center and double-blind RCTs to firmly embedded with the Shodhana and Shaman Nasya protocol into global neuro rehabilitation and psychiatric practice. I also remember one of the research which has been conducted on the Alzheimer's disease, Alzheimer's dementia, where the Brahmigrata has been taken, and Dr. Reshma Nair from Ayurveda Medical College. When I have initiated that one, and then after a couple of years, I just moved to other institute. And then the study continued, and it was an annual experimentation where the emulsion is being first tried. We tried, making the Brahmigrata emulsion, and then that is being administered to the rats, and it is found to be very beneficial in management of the Alzheimer's disease. And this is how we need to progress. Probably my take-home message, what I would like to give is that we need to progress. We cannot be a stagnant one, and there are so much of researches going on around you, and we need to be receptive, and we need to take what is good for the system, what is useful for the system, and the advancement is in the pipeline, and we need to be open-minded, and we need to accept things and move ahead collectively to make this Ayurveda global system of medicine. This I conclude. Thank you very much. Thank you for the organizer for giving me this opportunity, and I hope I have taken more time. But thank you, audience, for patient listening. Thank you.
Thank you very much, sir. Your scholarly insight, practical guidance, and clear explanation of both classical concept and their clinical application have greatly enriched our understanding of concept of Nasya. Thank you for your enlightening lecture, sir. Now we shall move on to the interactive question and answer session. I request the participant to kindly post their questions in the chat box.
So let me read this. Explain the mode of action of related to Pumsavana karma. You see, it is
Sir, I will read.
is any
I will read.
concept behind the right nostril installation, the male baby, and the left nasal installation for female baby, and its determination in Pumsavana karma. There are two different varieties of Pumsavana karma which is there in the classics. One is Lakshmana, which is endangered species. But as far as my information is concerned, it is Dharba or Durva. There is a Durva which is there in the Rigveda. Rigveda it is there. But specifically, thinking from the scientific background, what I would say is that the drug is not going to absorb through the nostril, or maybe there is some kind of absorption maybe there through the lymphatics. So with the absorption, you cannot say that the action is happening. Some sort of Daiva Vipashri Chikitsa, if you are thinking, that is quite possible, which I am not the master of this one, but probably that may be there because it is from the Veda, point of view, Rigveda. From Rigveda, this sort of practice is being done, but I feel the absorption through absorption it is not there. I don't know. I would say that I don't know how exactly it is going to act because Pumsavana karma, it is not my domain also. People do not come to me for Pumsavana karma, so I do not know.
Thank you, sir. Next question is, sir, since manual blowing produces variable pressure, what innovative instrumentation can be developed to deliver a fixed and reproducible pressure during the Pradhamana Nasya?
See, it is actually blowing process. There are variable pressures, of course, I understand. But the nadi, which is being utilized, and 6 angular, the length is being explained, and the sustainable, the blowing, it is being told. In order to make it not more irritant, there are few, change in the instrumentation is also being done, like using a cuff of the blood pressure. That is also being used for blowing that one, because whenever the person is blowing, then there is a chance of contamination and the oral contamination may be there. That's the reason why that is not good. So in order to make uniform pressure, it is very much essential to make or prepare one instrument. That is the only way how we can come out of this.
Thank you, sir. Next question is, sir, can we mix the Kashaya, Taila and Grita to improve the drug bioavailability? And we have the direct reference of it in Chakradatta Vatavadi, Prakarana in Vishwachi and Avabhavka. But the thing is, Acharya didn't mention the dose, which is Uttarabhaktika Sayankala Nasya.
Uttarabhaktika?
Sayankala Nasya.
Uttarabhaktika Sayankala Nasya. See, this is actually, that's what I was just talking about. See, from where I forgot to talk about this Nasapana. Probably you are speaking about this Masha Ballari Nasapana, which is there in the Chakradatta. So they have tried their level best to like a Taila, Grita is added with the Kashaya and other things. Now the question is that the Taila has got a different molecular size. Grita has got different molecular sizes, and it is not being made in the nasal administration as well as the external skin ointments. Also, this kind of formulation is being used, but this is not being used in this formulation. This is the reason why we need to look into the classical version that from where this concept of Nasapana has come. When you see in the contraindications of a post Nasya, post Sneha Nasya, there is a contraindication that after administration of you are not to take it inside your stomach. That is what is the explanation which is there in the Sushruta Samhita. And the Sushruta Samhita's commentary, Dhallana speaks about this one and he gives a reference of Videha. And Videha says that this context is specific to that of Snehanasya. And Videha says that there is a chance, there is a possibility. Who is eligible to take this Nasya, which is being administered to the nostril, to engulf it and take it inside to the stomach? Then he explains few of the things, specifically Vata dominant disorders, person who has got Kshina Balamamsa, person whose Agni is very good. These three things are very innovative things and they are very much essential. If these three things are there and then the person is asked to take inside, then it is fine, there is no issue. And one more thing, he says that benefit of this Nasapana, he says that it will increase Tarpana, Dhatu Tarpana, it will do Dhatu Tarpana. So Dhatu Tarpana happens to those person who is Kshina Balamamsa, person who is Vata disorder, who is having Vata disorder, and person who is having good Agni. This is a prerequisite. When these three prerequisites they meet, then naturally this is an indication for Nasapana. This we have branded it as Nasapana. And Chakradatta's version and the later Acharyas, what they did is that they have added Hingu also, they have added Masha also, they have added Attagupta also, they have added Bala also. So multiple Kashaya they have made, and Taila also, you add Taila, add Grita, and then add Vinsta. So these formulations, you see, this kind of formulation, whenever you are taking inside, Uttara Bhaktika, you are saying that you take it. So it is, whether it is Nasya, that you have to answer, because Vishwachi and Apabahuka and Pakshagata, these three are actually being indicated in this Masha Baladi Nasapana. So Nasapana, it is Nasin Pibet. So there are different researches are conducted. But how far we are confident that the drug is going to get absorbed? Minimally absorption is possible. The idea of this Nasapana, especially whenever this Neha Nasya is administered, is that the drug is going to act on the nasal mucosa. It goes through the olfactory bulb, or otherwise it also acts over the trigeminal nerve, and then it gets to the central nervous system, reaches central nervous system. Partial action is this. Partial action of this drug itself is that the drug is being taken inside, and this will pass through the first pass metabolism, and this is also going to act in the normal routine way how the oral drug is going to act. So this is a dual action of the Nasya which is being highlighted there as far as Videha's version. And this version, I do not personally agree with this kind of the explanation. What he has given is that the Kashaya, Taila and Grita all mixed and it is being administered. So personally, I do not believe in this kind. Of course, I have tried in a couple of patients, but I couldn't get any relief out of this one. So that's why I just thought that probably when the absorption is essential, because condition, if you are not making the right combination, right administration, then probably yield better relief. This is what is my opinion.
Thank you, sir. Next question is, in emergency condition, which kind of Nasya along with the drugs to be used and the probable mode of action?
Already I have explained Visha condition and Sannyasa, Mada, Murcha, all those conditions are considered. Condition, reticular system is being targeted. This is what is the action. There are Nasya. In the context, I have seen one patient I have treated, the case of CA of brain, and the patient was in coma for 6 months. And patient was actual patient party. They were knowing the attenders. They know that the patient is anyhow because the old lady, and she was in coma for 6 months. And in our hospital, the patient was brought, and they said that it is just for continuing the treatment, not in All India Institute, but it was in Alvas. So there actually we have tried this Smriti Sagar Rasa Pradhaman Nasya. To our surprise, within 2 sittings of Pradhaman Nasya, patient started opening her eyes for some like fraction of seconds and then close. Again, whenever we used to do, again she used to open and close. And this continued for 5 to 7 days. And then she started opening once or twice a day. And then, of course, the later stage, of course, only this was the improvement we could see. So that shows that the patient who is in 6 months of coma, still the person can be aroused, like the reticular system can be, stimulated. So this is what is the explanation for this, that they immediately then you can do it. In case of Visha also, there are so many Pradhamannasyas are explained that can be incorporated. So in case of Pakshagata, very acute Pakshagata, where the person is having an infarction, mid-cerebral artery, specifically mid-cerebral artery infarction, and the person is in stupor condition or delirium condition. In those conditions, Aupedakanasya is also tried and is found to be very beneficial. So the action is the same, the path is same. So there is no absorption there as far as the drug is concerned. And this is stimulation of the blood system.
Thank you, sir. The next question is, sir, have you practiced Shodhan Nasya in a divided dose as Tribhaga Aushadha is mentioned by Ashtanga Sangraha? This applies for only a large dose of Nasya?
No, actually, you see, this dosage which has been explained, the Tribhaga, what he says, and it should be understood in a very clear way. That the Basti, while explaining Basti also, he says that Triputaka. So Triputaka, why it is been prepared and you keep it ready, because whenever the patient gets into the Ayoga Vyapat, there is always one more dose has to be administered. Either in the larger dosage or otherwise more potent dosage. Potent drug has to be selected. There are 2 possibilities. So here actually the dosage has to be increased. In that condition, definitely the Samyak Lakshana has to be assessed, which we have forgot these days. So Samyak Nasya Lakshana has to be assessed. And if Ayoga Lakshanas are observed in that particular case, which need to be ready there itself. It is not that after 10 minutes, 50 minutes, or what is being explained. Larger dosage, it has to be administered at once. At once, it has to be administered. So there is no question of like wait and 3 times, 3 part.
Sir, in Pakshagata, during the Avarana Avastha, which treatment should be prioritized first, Virechana or Nasya Karma, except the Nasya as Sanya Prabodhana?
That is the question. Pratimarshana, I think, okay, this one you have missed out, I think. Okay, you can ask that. In Pakshagata, during the Avarana Avastha, which treatment has to be prioritized? First, Virechana or Nasya Karma, except Nasya as a Samnya Prabodhana. See, Virechana is indicated only when person is Balavan. And again, there is one more Nyasa condition, which is because of Rakta Avarana is there. Specifically in conditions where the person is having hemorrhagic infarct or otherwise cerebral hemorrhage. There are 2 possibilities. And cerebral hemorrhage is always risky one. In all the cases of cerebral hemorrhage, if a large area is involved, either patient will go into a grave complication or otherwise patient recovers very well. There are 2 possibilities. In the initial stage, the Raktavarana is there, then stabilize the patient, then you plan for Virechana, that is well and good. After a few days. It is not that immediately you will be doing Avarana Hara, means doesn't mean that it is only the Yeranda Taila administration. Virechana, when you are speaking about Virechana, it should be Chikitsa only through the Yeranda administration or Yeranda with Kshira or Yeranda with the Gomuta, Yeranda with the Triphala. and different formulations of Yeranda, Nimbamrutadi Yeranda, Gandharvastadi Yeranda, Nikundi Yeranda, all those things are there different. But it is an instantaneous evacuation. It is a post-shuddhi you are speaking about. It also acts as the avarana. That is a different matter. Second point is that if you are planning for the classical Virechana karma, then it has to be the person's bala should be good, and the criteria which meets, like Rakta Vratavata condition is there, and the patient is Balavan, patient can tolerate this treatment, then only you can plan for the Virechana karma. Whenever the patient is in the Madhamurta Sannyasa condition, you can plan for Pradhamana Nasya, or Aupedaka Nasya. In the later stage, you can plan for other varieties of Nasya. One more point to be considered in Pakshagata in acute stage is that the person who is having the infarct, mid-cerebral artery infarct or post-cerebral artery infarct, in those conditions, Nasya can be definitely selected. Nasya in the form of the Shodhana Marsha Nasya can be selected, followed by Shamana Marshanasya, then followed by Brahmana Marshanasya. That can be selected. There is no question of non-selection. One more point has to be considered is that the Pakshagata facio-brachiocrural hemiplegia. And the patient is having the hemiplegia along with the facial paralysis, the upper motor neuron kind of facial paralysis. Nasya is the first choice of treatment compared to that of anyone else.
Thank you, sir. The next question is, sir, significance of 3 Muchuti dose of Pradhamana Nasya, because as like other form of Aushadha will completely go inside the nostril and comes out. But in Pradhamana, it won't go, no, sir.
No, mucosal clearance, already I have spoken about this one. Probably with the force and the drug, and it should go, and then it will adhere to that particular nasal mucosa, and sustained action also may be seen in case of Pradhamana Nasya. But our intention is that the drug has to act very immediately. That's what I said. There are 2 possibilities of Pradhamana Nasya. Pradhamana Nasya, most of the times we consider only for Samnya Prabodhana. Then it is our misconcept. It may be utilized in case of the sinusitis also. Suryavarta case, frontal sinusitis also it can be selected. In case of maxillary sinusitis, it can be selected. Shirashula, it can be selected. So in those conditions, more than the central action, the local action is more preferred. Whenever you are speaking about the Trikata Churna, that acts more locally than centrally. Whenever you are giving the Vacha Churna also acts locally as well as centrally, because it is an aromatic drug. And whenever you are speaking about the Rasaushadis, they act centrally as well as locally. The Shwasakutar Rasa, that is also in practice, Shwasakutar Rasa also is administered in different conditions. Specifically, the arsenic compounds, they are actually poisonous. And you have to be very careful in utilizing all those arsenic compounds through the nostril. So these are some of the area that has to be worked out, because Pradhamana Nasya, you cannot get biased, because we tend to have a very clear version that Pradhamana for Samnya Prabodhana, Dhuma for it is extinguished. We are not going to use, only Dhumapan we are going to use. Pratimarsha Nasya, only 2 drops we will use. And Nasya, all the time, everyone is using Navana Nasya or Marsha Nasya, which is not really practically correct. There are so many other varieties are there. Judiciously, practically, anybody has to select these options.
Thank you, sir. That brings us to the end of the question and answer session. Thank you to everyone who participated by sending the thoughtful questions. As we come to the end of session, I warmly invite Dr. Shilpa Shri ma'am to deliver the vote of thanks.
Good afternoon, everyone. I am very much delighted to deliver vote of thanks for today's enlightening webinar on comprehensive principles and practice of Nasya, conducted under the webinar series Karma Chintana, organized by the Department of Ballari on the occasion of Suvarna Sambhrama. First and foremost, I express my sincere and heartfelt gratitude to our esteemed speaker, Dr. Praveen B.S. sir, for delivering such an insightful, informative, and inspiring session. Thank you so much, sir, for sparing your valuable time and sharing your expertise with us. Thank you, sir.
Thank you.
Next, I My sincere gratitude to our respected principal, sir, Dr. Rashekar Gange, sir, for his constant support and encouragement. Thank you so much, sir. And I extend my thanks to our respected HOD, Dr. Santosh L. Edali, sir, for successfully organizing this marathon of webinar series for whole month. It was very helpful for all the Panchakarma PG scholars all over the India. Thank you, sir. I sincerely thank all the faculty members, organizing committee, technical team, and all our PG scholars for constantly working wholeheartedly and supporting us, which made this webinar series successful. And last but not the least, thank you for all the PG scholar participants all over the India for attending our webinar series and making it successful. Thank you. Thank you, one and all.